morning, afternoon or evening to all of you who've joined us today. Thank you so much for taking part in this Policy Dialogue seminar. Policy Dialogues is the name of the new series of monthly seminars from the Johns Hopkins University Universitat Pompeu Fabra Public Policy Centre, which aims to make knowledge around policymaking and its impacts on people's quality of life and well-being more accessible. So for these seminars, we invite speakers to discuss important current issues from their different perspectives and experiences, with an emphasis on policy proposal and social change. And we encourage dialogue between speakers and participants as a way of democratizing knowledge around policymaking and to prepare ourselves for a more just and sustainable future. So today we're going to be discussing an issue that's often been silenced, overlooked or obscured, which is that of health inequity and medical apartheid in Palestine. Following many years of advocacy and work by Palestinians, and as a result of intensive on-the-ground research, in the last few years, multiple Israeli and international human rights organizations, such as Human Rights Watch, B'Tselem, and Amnesty International, have denounced Israel's treatment of Palestinians as a system of apartheid, understood as the domination of one racial, national, ethnic group over another. So today, the Centre is delighted to welcome Dr. Yara and Osama Tanous to discuss how this system of apartheid is manifested and reproduced in the health system of Palestine and the consequences that it has for the health of Palestinians. Yara is an assistant professor at the University of Central Florida in the School of Global Health Management and Informatics, and a visiting scholar at the FXB Center for Health and Human Rights at Harvard University. Her research agenda focuses on global health, human rights, and development in fragile populations. She's a non-resident fellow at the Arab Center, Washington, D.C., a 2020 to 21 Fulbright US scholar to the West Bank, the full 2021 US fellow at Al-Shabaka Palestinian Policy Network, and the co-chair of the Palestine Health Justice Working Group in the American Public Health Association. She's also worked with Amnesty International USA and the Palestine American Research Center on Policy and Outreach Issues. She's presented at multiple national and international conferences on topics related to global health, food security, health informatics, and women in healthcare, and has published extensively on health and well-being in fragile and conflict-affected populations. Her work's been featured in various international outlets, and her forthcoming book with Johns Hopkins University Press examines war as a public health crisis. Osama Tanous is a specialized pediatrician based in Haifa, Israel. He's a researcher at the FXB Center for Health and Human Rights, Harvard University, and the Galilei Society, the Arab National Society for Health, Research and Services. He's a board member of Physicians for Human Rights in Israel, and a member and writer of Al-Shabaka, the Palestine Policy Network. His research is largely focused on structural violence and health disparities, and he published in the International Journal of Health Services last year on the effects of structural violence on Palestinian children's health. So as you can see, the two speakers have extensive experience and knowledge on health disparities and policy in Palestine, and I thank them both very much for sharing that knowledge with us today. They're both going to present, and after their presentations, there'll be a question and answer session for around 30 minutes. So I encourage you to all please share your thoughts, reflections, and questions in the chat as I'll be reading them out during this discussion. So without further ado, I'll now pass over to Osama Tanous. Thank you very much.
Thank you, Eve, and Institute for inviting us and providing a space for this much needed topic. And thank you, Yara, for doing this with me. And thanks you for the audience. I hope we can have a fruitful discussion afterwards. So I will start. I think it's just important to note that both me and Yara we work together quite often, and we are. This is a field that is in process. The whole the study of apartheid and more the study of medical apartheid in Palestine. It is not well defined. We are trying to understand its complexities and its contours as we go along. The word medical apartheid has been used in different contexts, both in the USA and in South Africa, in different terms. So we will try to provide evidence from the ground. How does medical apartheid looks like? Okay, so I know that the news about health in Palestine it's very confusing. Even our president is very confused, and you often hear talks about Israel providing help to the Palestinians. Of course, it came along strongly with the COVID pandemic about Israel's obligation to provide vaccines. Should it give vaccines or should it not? Should the Palestinians take care of their own vaccine supplies? And you often hear the news about Israel providing treatment for Palestinian children, but on the other hand, you'll see Israel bombing clinics and hospitals, and it actually bombed the only COVID laboratory in Gaza during the war. And the whole talk about the vaccine deal that collapsed and so on. So all of this is very confusing, and if you just follow the headlines of the news, it's very it doesn't provide the full image of how things actually are, and we will need to we will try to provide a historical analysis and a historical reading of this process. Okay, so in order to do this, we must engage with the issue of what does it mean to have apartheid in Palestine, Israel, and what does it, how is it different than other forms of apartheid? There was a big discussion after the publication of the reports. Is it truly settler colonialism or apartheid? Which framework captures the situation more accurately? And we think that both do, and we need to understand both of them in order to fully understand what's happening on the ground. We need to, first of all, understand that there is no such thing as the state of Israel and the state of Palestine. These are not two sovereign or border states. Israel actually does not have a clear border, and they are constantly expanding as a colonial frontiers. For this, as I said, we need a true understanding of settler colonialism, which means that although people have been traveling, individuals, populations have been traveling across time and space forever throughout history, what is particular about settler colonialism is that unlike migrants or refugees, settlers move with sovereignty. They move in order to create a new sovereignty, not to integrate within the existing society, but to create a new society with a new population, a new set of rules, a new language, a new political structure. And in the process, it eliminates the native. So we can see similar processes that happened in North America, in Canada, in Australia, and New Zealand, where a group of settlers come at that. In these instances, settler colonialism was much more defined by a massive scale genocides, complete killing, massacres, depopulation of the indigenous to make them either a very small minority, usually it's around like 3% to 5% of the population, and then create a population of settlers, and then the settlers become the natural inhabitants of the land. In Palestine, this process has been different. So the world after the World War II could not tolerate this amount of massive scale genocide and depopulation similar to other parts of the world, similar to America, Canada, and Australia. So new tactics had to be invented and used. Mostly the expulsion of Palestinians. So as we see here in the Nakba, the majority of the Palestinian people were expelled from their land. and were not allowed to return. But then a significant portion of the people still remained in historical Palestine, either Palestinians who became citizens inside the Green Line, inside Israel, or Palestinians in the West Bank and the Gaza Strip, who are either from these areas or are refugees from inside the Green Line and became refugees. The way to manage this demographics, and because Israel was very careful in being a democratic state, and unlike South Africa, where they did not want to have the image of a small white minority who has democracy versus a big Black majority, it needed to create much more practical tools. And these, in here we can talk about creeping apartheid. So apartheid was used in order to create different categories. First of all, compartments of Palestinians, either ones that are inside Israel, ones that are in the West Bank or in the Gaza Strip, in Jerusalem. Each of these have different a different ID card and different category of residency or citizenship or a colonized subject, and and there is a system of a Jewish supremacy from the river to the sea, and that is what fulfills the criteria for apartheid. And again, since it's settler colonialism, it is about expansion, the expansion of the frontiers. So here we can talk about the expansion of the settlements in the West Bank. Before it was in the Gaza Strip, and then and in the Julan Heights, occupied from Syria. How does this? Yeah, next slide, please. Okay, and often we are used in apartheid and in medical apartheid, either in the USA or in South Africa, to talk about race and racial superiority. Race is not the word race is not used very much in Israel Palestine. People talk more about religion or ethnicity, and this has its own background why people do not use the word race, but it's important to understand that race, it is not a biological category. It is nothing that is medical or biological or scientific. It is a construct, a social constructs of its environment. If we are in Ireland, we can talk about being Catholic or Protestant or so on as racial categories. In the USA, about the interpretation of the skin color or the hierarchy within the US history of indigenous versus people that were enslaved and migrants and so on. So racialization is a process that is created while people and population are being targeted. It can follow religion, citizenship, different forms. And in settler colonialism, the settler becomes to be seen as the volk, the nation, the natural inhabitant of the land, versus the indigenous that is seen as an intruder, a tolerated guest, or so on. And in the process, settler colonialism always aims to replace the population, the native population, with that of settlers. Okay, so how does this process that I have talked about contribute to health inequities and medical apartheid? So as we know, the health of the population, whether we are talking about the quality of life or life expectancy and different patterns of disease, they are much less dependent on the medical treatment that we receive. It is less important if a population has a good medical treatment and access to it. Of course, that's important, but most of it is determined by the social determinants of health, the conditions that create the environment where that we live, enjoy, where we grow up and age and die and become sick and so on. in that sense, similar to how we can understand racial disparities in other settings in the USA between the white population and the Black population, or the native population, we can see a clear disparities between, and that follows this hierarchy of citizenship and race construction. So between Jewish Israelis that have the highest life expectancy, Palestinians who live inside Israel, Palestinians who live in the West Bank, and then Palestinians who live in the Gaza Strip. So the condition, the living condition that this entire system of settler colonialism, structural racism, and apartheid has engineered for the population has a massive impact on the health of each of these populations. Okay. And so how can we understand in that context medical apartheid? Medicine has been always entangled with colonialism from the beginning, from the early age of colonialism, when the European empires were colonizing and occupying territories in Africa, in Asia, and Latin America. Medicine was a crucial tool also to keep the soldiers fit so they can occupy these territories. Often it was about the whole field of tropical medicine was created and used in order to keep the soldiers and the settlers fit so they can take more and more land. And we know that the spread of viruses and diseases was often used in order to get rid of entire indigenous populations. In our context, it started very early because it is settler colonialism. It is not about soldiers occupying a territory like in the case of the British colonialism of India or Egypt. Here you are talking about a big amount of settlers that you are bringing to a new territory with a new climate, new water, sanitation, and hygiene, and you want them to be fit so they can colonize the land. So in that sense, medicine was a crucial part of this colonial infrastructure. It started early on before the Nakba, before 1948, when the group of settlers were establishing healthcare associations. It followed the German model, the Bismarckian model of we see sick funds, or it's called Kupat Hulim. So this was a kind of a German model to create associations that are not for profit that aim to keep the population healthy, to run clinics, hospitals, emergency care medicine, and largely public health was used as a tool to shape this new nation, and it was also a goal by itself, but also a condition that in order to truly colonize the land, you cannot afford to be sick. Every other day you need to be fit. Sickness was seen as a waste of funds and a labor that is necessary, very much like in the capitalist logic. So a portion of the income was devoted to establishing these sick funds. And of course, that followed entire notions of Orientalist notion of seeing the Palestine as a regressive, not progressive place where you need to bring Western innovation and Western medicine and so on, and Western hygiene in order for it to be livable and fit for the settlers. Okay, this has created the Israeli healthcare system as we know it today. From the early days, they established 4 sick funds. All of these were established before 1948, before the establishment or the declaration of independence of Israel. And then you had mother and child clinics that take care of vaccinations and of the follow-up on development. Then you have hospitals, all of this that belong to the Ministry of Health or to these sick funds. And this is has created a a very specific and efficient model of healthcare, very different than what people know in the US. It is not for profit in a way. It is governmental, but has governmental supervision and subsidies, and has a small amount of competition inside of it, but largely regulated and largely has a colonial origins in its understanding that it is made by settlers for settlers in order to keep them fed. Okay, and here we can see that this model is largely celebrated in the world as one of the very good, successful, and efficient models. So if we can compare how much money is spent per capita in Israel on healthcare versus the life expectancy, so we can see a very good and efficient results, you know, in that sense. So Israel is here versus the USA that spends way more money per capita, but still a lot of money. The system is less efficient in producing good outcomes. So it is widely celebrated as an efficient system. But this system, as I said, and it has its entire, we have our entire critique of it. As we said, the origins of the system were colonial. There is a huge amount of disparities when it comes to the Palestinians, citizens of Israel. But what is important to talk about, and in that sense here to follow, so that after the occupation of the West Bank and the Gaza Strip and the Julan, the healthcare system did not know the green line or national borders. So this system literally, you know, intruded into, followed the settlers. So if a group of settlers would come into the West Bank and establish, as in the beginning, it would be a small settlements, but then it will get, of course, governmental support and electricity and highways and schools and all of that. And the healthcare system follows the settlements. And again, I want to remind that the allocation of a population of settlers into an illegally occupied land is considered a violation of the Geneva Convention. It's a war crime. You take the land illegally, you move your civil population there illegally, you create these permanent infrastructures. All of this violates international laws, but the healthcare system did follows and still does the settler. And here we can see often in parts of this is taken from an advertisement, that the coverage even of how many hours you have of a doctor weekly hours per capita. The settlements in the West Bank have even better coverage than inside the Green Line. So it was really used as a project. And of course, these healthcare clinics in the West Bank provide healthcare only to Jewish settlers. So they do not provide healthcare to Palestinians who live in the same territory, unlike what happens in the Green Line, where these clinics provide healthcare both to Jewish Israelis and to Palestinians. So it has become a tool to normalize colonialism and make it much more solid, and provides a civil culture to this colonialism. Recently, Israel also opened not only clinics, but even a medical school in the settlements of Ariel, which is an illegal settlement in the West Bank. They have established a university and then a medical school. We have protested this step in Physicians for Human Rights, but also the Israeli Medical Association supported the establishment of the school in an illegally occupied land, and the universities also have accepted that and collaborate with that. So slowly we can see that the Green Line, or anything that people talk about, the two states or so on, becomes very irrelevant. And here, of course, you have a wall and so on. So you can see an entire structure of Jewish supremacy from the river to the sea, where healthcare is used as a tool and follows settlers. And how did that affect the Palestinian healthcare system? As we said, the whole process of settler colonialism have made the Palestinians have no sovereignty basically over their land. So they have very little. Palestinians have no sovereignty over the land, or they have no ports or airports. The whole movement of people, of students, of doctors, of equipment, everything is conditional to the Israeli laws. This has created a very chaotic, mishmash of healthcare providers that includes government NGOs, the private sector, the Palestinian Ministry of Health that was created after the Oslo process, and Yara will talk more about that. The UNRWA that was created specifically to provide healthcare and education for Palestinian refugees. What was seen in the beginning as a temporary situation became something that has been going on for more than 70 years. So while Israel has enjoyed, in that sense, sovereignty and independence before the establishment of the Israeli state, so even during the British mandate, they've allowed the Zionist settlers to create their own healthcare systems. Palestinians have been prevented of that and locked out of any access to planning before the Nakba and also after the Nakba. So this creates this very mediocre healthcare system that is largely dependent on foreign funds, especially after, again, the Oslo process, the whole funder community, and the change of the discussion about Palestine from a liberation discussion to one of humanitarian and funding. And this system, the money also that ends up poured into the system goes by referrals, either to when it cannot provide the necessary healthcare to the Palestinian patients, they purchase services from Israel or neighboring countries like Jordan and Egypt. So you can see it quite mirrors what we have in the political situation, a very strong Israeli system that is the independent, sovereign, and a weak, fractured Palestinian system that is dependent, captive, and ends up benefiting the Israeli healthcare system. And what do we mean when we talk about referrals? So again, whenever a Palestinian patient has, let's say, a condition like cancer or needs dialysis for kidney failure or transplantation or a complicated surgery, and as we said, the entire structure of the Palestinian healthcare system being under occupation and captive cannot provide that service, it refers the patient outside the Ministry of Health. So either to the Israeli system or to neighboring countries or to other private structures. And instead of, so there has been a lot of pouring of money and a lot of talks about, about funding the Palestinian healthcare system. But instead of, with time, making the system stronger and stronger, the system has become a contractor, basically, that just takes the patient and then refers him outside. And of course, all of this comes with delays and bureaucracy and delay of care and Israeli regulation. Yes, and we can see that in certain year in 2020, the purchasing of services have been a huge amount of the budget of the Palestinian healthcare system, almost 40%. So imagine if that money was actually invested in the Palestinian system to make it independent, to make it really able of providing the services it needs to its own people, and thus really not necessitating them going through these militarized borders and checkpoints and humiliation in order to receive healthcare. And I think this follows similar trends that we see with agriculture, with electricity, with water, with pharmaceuticals, where every aspect of the Palestinian life has been is captive basically to the Israeli system and ends up benefiting it and dependent on it. And needless to say that the permit, or maybe it is we need to discuss this. So there has been one aspect of the apartheid regime is the permit regime, and that is specifically necessary for Gaza, but also to the West Bank. So every Palestinian patient that needs to get a treatment in a Palestinian hospital, mostly, not in an Israeli hospital, needs a permit from Israel to go mainly to Jerusalem. So Jerusalem has been for ages the central, really the center of Palestinian hospital. It has several very good hospitals, and it had all the experts and the experts in human resources and equipments and so on. And it will get patients and concentrate patients from Gaza and from the West Bank who could and should, be able to travel freely to Jerusalem. But also the movement of patients from the Gaza Strip and the West Bank to Jerusalem that has become completely under Israeli control needs a permit. And this permit is dependent on Israel, and as we can see, it very much changes according how many permits are accepted from the first time or the second time. And this changes according to the mood in Israel and their hostility towards Gaza, if it's before a war or under or during a war or after war and so on. And some of our colleagues in the WHO have done excellent studies that show that this significantly affects the survival of cancer patients if they receive permit from the first application or do not. So all of this bureaucracy ends up, killing people, and not in the theatrical way that we are used to seeing people being killed at war, but this violent machinery ends up killing people. And of course, the Palestinian healthcare system is not only under these restrictions and regulations and the development that we talked about. Israel often directly attacks and targets Palestinian hospitals, clinics, staff, doctors, nurses, ambulances, and so on. So they suffer from both sides of also slow violence and direct violence. All of this cripples much more the Palestinian healthcare system. So we can see that if we were talking before about a system of apartheid, it's and the domination of one racial group over the other, I think we can see here something that's kind of beyond that. It's beyond domination. It really slides into necropolitics, into deciding who is allowed to live, who is allowed to die, how sovereignty really determines, and if you are born in what side of the green line, what kind of access you will get, and how is this whole structure of power, the right to kill, the right, and not just kill by direct killing, but kill by by cutting water and by cutting electricity and by not having vaccines during the pandemic and by bombing a COVID lab during the pandemic. So all of that, this relationship ends up producing a necropolitical state of mind. Okay, and this basically results in what has been often talked about, but this is just the tip of the iceberg, as we can say, of a vaccine apartheid. And if we were talking before about a global scale of vaccine apartheid between rich countries and poor countries and the global north and the south, and so on. So here you have all of that dynamic, right next to each other, where the political apartheid creates a vaccine apartheid where Palestinians Palestinians cannot buy, cannot have access to their own vaccines, and then having their occupying power not vaccinating them. I will hand off to Yara that will continue about the obligation of the occupier.
Thank you so much, Osama, for that important theoretical and practical framing. I think for a lot of people that may be watching, this phrasing and this framing of settler colonialism is relatively new. Even for people who support Palestine and acknowledge these health disparities, what we typically see is this framing of occupation, right, which is this military process. And so I'm going to talk a little bit about that, but then I'm going to show how that doesn't detract from, but actually is an intrinsic part of this medical apartheid. So I think it's important to note a couple things that have somehow become disputable facts in recent years in some circles, which is that initially, all major global entities, I mean the UN Security Council, the General Assembly, the International Committee of the Red Cross, which is kind of the holder of the Geneva Conventions, and even Israel's own Supreme Court within certain cases in the past few decades, continue to recognize and acknowledge that Israel remains the belligerent occupying power in the West Bank, Gaza Strip, and East Jerusalem. The occupying power is not just a descriptive phrase, but this is a legal phrase. Belligerent occupation is where the forces of one state exercise effective control over the territory of another, and here I'll use the term state loosely because, of course, Palestine is not a state, without the latter state's volition. And so this is in a belligerent occupation and acted through literally military means. So that means in the West Bank, there are soldiers, there are checkpoints manned by Israeli soldiers, there are Israeli soldiers at the Palestinian border crossings, Israeli soldiers consistently entering Palestinian villages, closing Palestinian villages, digging ditches to prevent Palestinian movement. It is a very active military presence. In the Gaza Strip, you don't have this military presence within the blockaded territory, but instead what you have is a complete blockade where Israel controls what comes in and out of the Gaza Strip, including how far Gaza fishermen can fish, which we'll talk about in their own sea, which we'll talk about in a few slides. So all aspects of Palestinian life are controlled by decree of Israeli military policy. This fact should not be overlooked, that Israel is the only sovereign entity on the land that is considered today Israel and the occupied Palestinian territories. So occupation is not inherently illegal. Occupation is written into the Geneva Conventions as a sometimes necessary component of a war. For example, you had the American occupation of Iraq in just the last few decades, but there was never this presupposition that America was interested in Iraq's land for its own purposes. They were occupying it in their mind as part of a military effort, which is a whole other panel that we don't need to get into right now. But occupation is a temporary structure. It is, again, the control of a territory by hostile armed forces. It is meant, you can't occupy your own land. You can only occupy the land of others that is outside of your own state. It's enacted through military means. And as such, because this is inherently not an illegal process, it falls under several mandates of international humanitarian law as laid out quite clearly in the Geneva Conventions. And so being an occupying power, you have certain responsibilities and obligations to the populations that you are occupying. So in this context, what does that mean? So I first want to, we hear occupation, we hear blockade, we hear how things are in the West Bank, but I really want to put this, what does occupation really look like? And how does this fit into this medical apartheid framing? So all the things that are part and parcel of the military occupation of the West Bank and the blockade of the Gaza Strip, this is the delineation between the populations. So in the upper left here, you see this woman observing her home being demolished. This is becoming more and more evident. Israelis demolish Palestinian homes, accusing them of not having sufficient permits to build their homes, and yet not issuing those permits. More than 90% of Palestinian permits for building in parts of the West Bank called Area C are denied. You have this checkpoint system. So this is a system that it's a form of collective punishment that assumes that all Palestinians are inherently security threats. And so to cross into the West Bank, to go out of the West Bank into Israel, and then even within the West Bank itself, there are Israeli manned checkpoints that are incredibly dehumanizing, can be an incredible waste of time, and can often even really block or delay your travel. The West Bank is a very small territory, and yet a trip from one town to another can take hours or may even be blocked entirely because of arbitrarily set up Israeli checkpoints. Then you also have this kind of spectacle of the Israeli military presence in the West Bank. And, if you're active at all on social media, you're constantly hearing stories of soldiers arresting children, killing people with live fire. And I'm talking in the West Bank. So even by the standards of, the West Bank is not sovereign, but there are parts in the West Bank that are ostensibly under Palestinian control. And yet Israeli soldiers operate quite freely, arresting, detaining, and harming, in many cases, Palestinians. You also have the phenomena of night raids of Palestinian homes. If they suspect that your child or a member of your family threw rocks that day, for example, at Israeli soldiers, they will come into your home in the middle of the night, unannounced, tear your home apart. There are many pictures of what this looks like, often very traumatizing. There's many videos of families with children being woken up by soldiers in their homes. Again, these are behaviors and practices only applied to Palestinians. In Gaza, of course, you have, every few years, this kind of ground war that results in really massive destruction and devastation of the population. You have a significant amputee population in Gaza for this reason. You, of course, have this visual display of segregation in the form of the separation wall, which was deemed illegal more than 15 years ago, and yet construction persists. And now it's to the point where they're building underwater netting as a barrier around the Gaza Strip. This cuts Palestinians off from their lands, from their schools, from their farmlands, and even communities were cut within themselves from each other. Again, the wall is illegal. And just to put a human name to this, several months ago, there was this Palestinian-American man, Omar, who was detained driving to his own village in the West Bank at night by Israeli soldiers, pulled from his car, suffered a heart attack when detained, died, and was left on the ground to be found by villagers the next day. And nothing was done about this. I think a few soldiers were transferred or something. And then just a few weeks ago, you had the murder of Shireen Abu Akleh, which is a Palestinian journalist. Multiple independent accounts showed that she was most likely definitely killed by Israeli fire. The U.S. even acknowledges that this is probably the case, and yet again, there's complete impunity on this types of direct violence. So whether it's the slow violence in the permit regime, the kind of structural violence of the walls and, the night raids, or the kind of direct violence of active killing and detaining that results in death, Palestinians are exposed to these stressors and these experiences simply because they're Palestinian. And so what does this, again, look like in practice? So, we hear about the blockade of the Gaza Strip. It's hard to convey how small the Gaza Strip is. This is an artificially created piece of land that was once a vibrant part of historic Palestine, but it was just a city. So this kind of strip that it's been kind of forced into is artificial. Most of the population are refugees that were displaced in 1948, and so they're living within Gaza. They're Palestinian, but they're not from this part of Palestine, and thus they're considered refugees. So you can see not only is there this barrier between Israel and the Gaza Strip, but there is a no-go zone and then a high-risk area that even further pulls where Palestinians are allowed to go. And many Palestinians that, cross into it, including, again, farmers accessing their land, medics treating people at protests, have been killed by Israeli forces, again, just within the Gaza Strip. And then here you can see the boundary in the water. And then I just want to touch briefly on, this issue of settlement. So settlements, I think, to many people's minds are these kinds of small, maybe communities, but that may be how they started. But today, these are full-fledged cities with infrastructure, with schools, with grocery stores that have connectivity to Israel. So you can see here on this map, the light beige parts are the parts allegedly under Palestinian control, but you can see here the blue and purple is settlements and outposts. So Israeli settlements are considered illegal by international law. Israeli outposts are considered illegal even by Israeli law. These are illegally put up settlements. And you can see how they're constructed. They're creating these small sectors of the West Bank where Palestinians cannot you cannot travel through a settlement. There's settlement infrastructure and roads that Palestinians are not allowed to access. And so, in practice, this isn't just putting up a couple of cities where settlers can live, but this is in decreasing, shrinking the land that Palestinians have access to, and also separating Palestinian lands from each other, such that, again, what should be a short trip often turns into an impassable or significantly delayed trip because Palestinians, again, are not able to access these lands. So this separation is present in every aspect of Palestinian life, from the land that you live in, where you're able to access healthcare, and the social determinants of health that affect all of us, but especially these kinds of fragile populations. So I'm going to just briefly, so we have time for questions, touch on the kind of this legal argument here. I want to go back to the Geneva Conventions, which lay out the obligations and responsibilities of an occupying power, which again, Israel is. And just to briefly go through this, all of this is available online if you'd like to read it specifically. So the occupying power, destruction is prohibited. So all these situations where we're seeing home demolitions or we're seeing active bombing is prohibited by an occupying power. The occupying power has the duty of ensuring the food and medical supplies of the occupied population. It should in particular bring in the needed supplies. So occupation is meant to be a burden. Again, it's meant to be temporary. It's not meant to last 55 years. To the fullest extent of the means available to it, and Osama just showed us how effective and efficient the Israeli health system is, the occupying power has the duty of ensuring and maintaining, with the cooperation of national and local authorities of the occupied population, the medical and hospital establishments and services, public health and hygiene in the occupied territory. So even if the settler colonial framing is maybe a step too far for many political stakeholders and players in this arena, even by the standards of international humanitarian law, Israel has a responsibility for Palestinian health. And so in shunning that responsibility, they are actively making a choice to consider these two separate populations that the state of Israel has control over. And you might think, well, the Palestinians, don't they get a ton of aid? And it's true. Palestinians have received about $40 billion in aid since the Oslo Accords, mostly as a pressure mechanism to get them to agree to many parts of the accords. But again, the Geneva Conventions maintains that relief does not relieve the occupying power of its responsibilities. So during COVID, many states donated vaccines to Palestine, including Israel, which donated, I think, several thousand vaccines. But this is not a replacement for the responsibility of the occupying power. The Palestinian population is still the responsibility of the Israeli state. And these are rights. So another critique that I often hear about this is, well, these are two sovereign peoples, right? You have the PA that runs Palestine. You have the state of Israel, which has its own government. And if Palestinians have bad health, that's the PA's problem. But the signing of the Oslo Accords in the mid-90s, which was meant to lead to a final status negotiation within 5 years, which would have been 1999, which is 23 years ago, does not negate the protections of the Geneva Conventions until the occupation ends, until the effective control of the government is by that government's or that territory's sovereign government. There is absolutely no argument to be made that the PA is a sovereign government, and we can save our critiques for the PA, of which there are many, for again a different conversation. But the existence of the Palestinian Authority does not negate Israel's responsibility as an occupying power, because they're still occupying the territories. They're still blockading the Gaza Strip. So they want to, you can't have it kind of both ways, controlling the lives of people essentially, but then claiming that you have no responsibility for them. So even if we do want to get into the Oslo Accords, which have been widely critiqued both at the time and in the many decades since as this kind of a calcified, out of touch, power dynamic imbalance, just a bad idea from the get go. And there was a lot of pressure at the time for Palestinians to accept it. And they did. But even in the Oslo Accords, there's a specific article with respect to health, which dictates that while the power and responsibilities of health will be transferred to the Palestinian side, again, assuming that this would be the seeds planted for a sovereign Palestinian state, Israel is still meant to coordinate and cooperate in terms of epidemics, contagious diseases, and ensuring that Palestinians can take care of their health, considering that at the time of the Accords, Israel had significant control over what comes in and out of Palestine. And many Palestinian negotiators who were present at the time noted that Israel specifically put this contingency in there because they were worried about an infectious disease outbreak on the Palestinian side that would come into Israel. Because at the time, travel between the two was much easier, as it is today. Tens of thousands of Palestinians work in Israel. So this was, for Israel's benefit to ensure that they would be protected from any potential infectious disease on the Palestinian side. So before COVID-19, you had this de-developed healthcare system as a result of import restrictions, as a result of threats on education for medical staff, as a result of brain drain from the lack of quality of life for these trained professionals. And this de-development framework was introduced by Sarah Roy in the late 80s and still persists to this day. The movement restrictions, including the permit system, Osama talked about, the separation wall, again, which is illegal, the checkpoints, which people have, many NGOs and press releases have reported people dying at checkpoints because they were delayed from getting to a hospital, women giving birth at checkpoints, and in some situations, the mother or the child dying in that process because they couldn't access care because they were stuck at a checkpoint. The blockade of the Gaza Strip, which keeps out not just, quote unquote military type equipment, but also the equipment, the resources needed to build hospitals, lumber, wood, cement, highly restricted. And then when you get into the specialized equipment needed for hospitals, even that is limited in terms of what can come in. For example, there is no PET CT scanner in the Gaza Strip. This is why people from Gaza have to apply to medical permits to get care in Israel or in East Jerusalem, because the supplies that they would need to take care of it in the Gaza Strip are barred from entering. So you've created this kind of captive population that is entirely dependent on a system created by the occupying power to receive what is often urgent and very time-sensitive healthcare. And then, of course, the active violence. This has persisted since the beginning since the Nakba, since the occupation. Pick a milestone, there has been violence exercised in that time period. And then, of course, you have repression, and this includes by the Palestinian Authority. So even Palestinians who wish to find a critique or to change the governmental system, talk about the PA, talk about ending Oslo, for example, they are repressed not just by the Israeli side but also by the Palestinian Authority. And then when the pandemic, so this is pre-pandemic, right? So then the pandemic comes, you have not just slow efforts by Israelis to support Palestinian efforts, but blocking efforts by Palestinians to deal with the pandemic, especially in East Jerusalem. So they, as Osama pointed out, they closed COVID-19 testing facilities. They arrested the organizers for doing so because they claimed they were affiliated with the Palestinian Authority, and Israel does not allow PA activity in East Jerusalem, which it claims it annexed, and yet it did not provide the services for Palestinians in East Jerusalem. And yet you had the UN kind of praising cooperation efforts because you had a few Israeli doctors and Palestinian doctors training together, or they had a few ventilators donated or something like that. So even in the UN, which completely accepts that Israel is the occupying power, which consistently criticizes Israel for its land seizures, for its treatment of Palestinians, they still look at a situation like COVID, and if they see any inkling of support or any cross-border maneuverings, they call it cooperation. And so this is the framing that we're stuck in. And then you had the vaccine debate of who is responsible for vaccinating Palestinians. Israel said many times quite overtly that it was not them, and nobody really pushed them on it, you know, despite the occupying power responsibilities and obligations. And so time just passed. People forgot. Palestinians got donations. They got a lot of Russian and Chinese vaccines. And here we are today. COVID is in its 4th or 5th wave, and still Israel has taken no responsibility. So is this really an occupation? Can you say that 55 years later? You had this report by the European Council for Foreign Relations in 2017 that claimed Israel's continued use of force to prolong its occupation is not justified by military necessity, but reflects government-sanctioned policies and practices of creeping annexation. And in some cases, not even creeping. You know, in 2019 and 2020, there was this overt push to annex parts of the West Bank. As such, Israel's occupation of Palestine has become unlawfully prolonged, and that is what has led, as Ave mentioned at the beginning, all these human rights organizations to say this is no longer just prolonged occupation that is, you know, part of this kind of just general war that both sides are a part of. This is a system of apartheid. This is a system with one sovereign treating two racially defined by its own, you know, government peoples differently for the purposes of settler colonialism. So moving forward, and I'll be brief on this so Osama can finish this up. Osama and I are part of kind of this small but growing critical scholarship on Palestinian health. And so much of the scholarship that exists and was necessary is kind of reporting and counting these issues. You know, what is the rates of PTSD for Palestinians? What are the cancer rates of Palestinians? You know, how bad is health really there? And while that grounding was necessary, we believe that it's long past time to move past this humanitarian framework. Palestine is not just a victim of a natural disaster that just needs temporary support and can move on. This is an active political project. And until we recognize it as such and stop treating it as though further aid, as the Biden administration just announced, will lead to any sustainable or meaningful change, we will continue this paradigm. You know, health is political, and so you have to understand how health systems function in the political and historical context. I think Osama did a brilliant job showing us how that works in this context, but that history is way too often left out of the conversation. There's been a big movement in global health, this decolonization movement, and there's many readings that I could recommend on that. But what's often left out of these conversations, to me, interestingly, is Palestine. There's often a lot of talk about decolonization, but without seeing Palestine as a colonial frontier. And so, yes, while we need to decolonize politics and public health, we also need to be willing to call it like we see it. And when we see a situation of active settler colonialism, even if it's politically uncomfortable, we need to be willing to call it that, or we're just saying we're not actually interested in solving this. And with that comes this deconstruction of these structures of power and privilege. All of the mechanisms that we've discussed in this talk are expressions of not just violence, but power. And so how can we deconstruct this power in such a way that both recognizes the political and historical aims of these structures, but also what does the future look like? Where should the power centers be? You know, these are questions that we're trying to answer and that we hope a newer generation of Palestinian scholarship can answer. And now I'll turn it to Osama to close us out.
Okay, thank you, Yara, for the brilliant analysis and description of the situation. So I think you know, it was very telling that the recent trip of Joe Biden to Israel, and then he did a few hours in Bethlehem. It touched on our topic. Of course, he did not talk at all at any, you know, before, even when it was direct unilateral support to Israel, at least there would be some kind of talking about either a two-state solution or peace talks or so on. Now this is kind of out of the question, and Palestine has been completely left as a humanitarian issue. And here we can really see the the use of really the dark side of humanitarianism in its worst, and he pledged to give $100 million to Palestinian hospitals in the West Bank, and to support some kind of collaboration between Palestinian doctors and Israeli doctors in order to build trust and so on. And again, it's really important to re-understand, although yes, the Palestinian healthcare system is underfunded and needs money and equipment and training and so on. Any suggestion that that collaboration between the occupier and the occupied would lead to any form of improvement in the healthcare system is completely false, and it will only prolong the occupation. It will only make it more natural, give it a more humane face, as our one of the kind of pioneers in the field, Rita Jakaman, has written. We should be only targeted towards the freedom, justice. This is the only way to move forward with building a just peace and with building dignity and sovereignty for the Palestinian people to build their own healthcare system. We need to again, here we're talking about policies and policy dialogues. So there is an urgent need, of course, to deconstruct the entire power structure to really create a viable democratic sovereignty for the Palestinian people, but also to de-link it from the healthcare system, not to give any more money to the Palestinian system so it can give it back and transfer patients to the Israeli system, and in that sense really talk about false hopes of collaboration and cooperation and peace, but to really de-link these together, and in that sense with the mind of how to also create sovereign healthcare systems and economies generally in the globe, how not to have poor countries and countries in the global south completely dependent on medications and on aid and health from the global north, but a larger movement towards the justice and equity. Thank you.
Thank you so much to both of you. That was, extremely interesting presentation from both of you. So much information there to digest. But yeah, thank you very much. To all of the participants, if you'd like to write any questions or reflections or thoughts in the chat, please go ahead. I think you can also raise your hand, and I can see that and give you permission to speak. So if you prefer to speak directly, then please go ahead. I don't see any questions so far, so I'll just go ahead myself with a question something I've been wondering. Based on what you said, do you think, because obviously there's been such a struggle for such a long time for Israel to be recognized as a system of apartheid, for people to accept openly and to be able to talk about it as apartheid, and I'm just wondering, as people involved in the struggle for health equity and fighting against this medical apartheid, do you see that since these organizations have called it apartheid, do you see that that's kind of created a turning point? Do you think that that's having an impact on movements for justice in Palestine, especially within the area of health? Because quite often there's these kind of rupture moments, that change the direction of things. I'm just wondering to both of you if you feel like that's happening at the moment. Thanks.
Osama, do you want to start?
No, you can start, yeah.
So, I mean, yeah, has there been a sea change? I don't know. I do know that for decades, students at colleges have been holding, Israeli apartheid weeks and have been really criticized for doing so. And this was kind of a third rail that you could not touch, in the early 2000s, early 2010s. I think the fact that this is a conversation that can be had is something that those activists would see as progress. And I do think that having these meticulous and comprehensive reports by organizations that are otherwise always cited by the US State Department and all these other Western governments, they're quoting Amnesty and Human Rights Watch in Turkey and China and Saudi Arabia and Myanmar. And so I think for them to bring their credibility and say, now we have evidence to suggest this is progress. What it means on the ground, I'm less sure of, because we're kind of seeing this democratic backsliding in general. And so I think apartheid only helps if you see it as a problem. And so I think when you see kind of the US president, who initially claimed to put human rights at the center of his presidency, you know, shaking hands with the Saudis, you know, shaking hands with Sisi in Egypt, kind of cozying up to these authoritarians for political aims, I do wonder if what the effect of this, you know, human rights campaign will be in this kind of realpolitik world that we now live in, where it kind of doesn't matter as long as you're useful. So I think it will be supportive for grassroots organizing. I think it will be helpful for fundraising. I think it will help more people see the reality. Perhaps in time that will translate to policy changes. I think we have to be optimistic because we have no option. Ultimately, it's progress, but I wonder how much politically.
Yeah, I fully agree with Yara. If you look at facts on the ground, there is really, you know, there's no reason for optimism, right? Things are only getting worse, whether in Gaza, and I see it like through my work in the, may go into the mobile clinic in Gaza Strip or the West Bank or so on, the amount of you know, how the severity of everything, basically, of the violence, of the occupation, the poverty, the normalization of everything, right? That this normalization that even you know, every few years Gaza will be bombed and then rebuilt and then bombed again and rebuilt and so on. And the West Bank, you will have expansion of settlements and you will have more removal, and in Jerusalem, and also here the ghettoization of Palestinians inside Israel, and marginalization and police. So all of that, of course, there is no a reason for optimism. But as Yara said, I think Palestinians have been used to this for a very long time, and we cannot afford pessimism. We cannot afford any other way, because we have to wake up and move right on the next day. And of course, when you look at the transformation on the discussions around Palestine in the world, mainly like in US colleges and universities, and in some Israeli human rights organizations. So of course there is a good discussion, but and again, apartheid is, at least it's a crime by international law. It is punishable, but it's a crime if you're really willing. Like Israel has committed, you know, endless crimes before, and it was never held accountable from the beginning, right? The UN also supported the return of the refugees from 48, but but then we can see this always policy of always testing what can you do until you get punished, right? So you occupy, and then you build settlements, and then you build a wall, and then you do a siege, and then you occupy also parts of Lebanon and Syria and Egypt and so on. But and none of this is held accountable, right? So we hope that to see a change. We know what is our role in this change is to do in terms of changing the discourse, at least around healthcare, right? Because in the anything that has to do with medicine and health, Israel is until now hugely celebrated. You'll see it even among critical voices on journals that seem to be progressive and left and so on, in the Lancet and other places. There is only celebration of Israel with very little critique. So yeah, we know that we will continue doing this and hope for a better future.
Thank you so much to both of you. I don't see any other questions here, so unless anyone wants to go ahead, I have more questions. Another thing that I was really interested in, because I think a lot of people understand, or maybe they can see more clearly, the disparities, the health disparities between Palestinians in the West Bank and Gaza compared to people living in Israel. But I was just wondering if either one of you or both of you could expand a little bit on the health inequalities within Israel, and especially focusing on policies. How do these policies work so that, you know, two people, potentially citizens of Israel, have such different health outcomes? Thanks.
Okay, so yes, I can expand. So I live in, I'm a Palestinian citizen in Israel, so I can, this is like my daily work and reality. When we analyze health outcomes of a population, we look at two things. We look at the what we call the social determinants of health. So the living condition, the condition of the towns, neighborhoods, the economical status, education, racism, all of that. And then you have access to healthcare, which is the minor part. So when we talk about the social determinants of health, we need to remember Israel was not created as a state of all its citizens. It was created as a Jewish state. The state is a structure that aims to benefit the Jewish people and privilege them. This is a clear policy of the state, and it's even recently has been incorporated into a national into a basic the nation state law, which states that Israel is the Jewish people, the country of the Jewish people, and establishing Jewish settlements is a national value, and so on. So unlike the USA or France or any other country that there are multiple levels of racism, but at least claims to be a country of all its citizens and claims to have equality. Israel doesn't even claim that. This affects every aspect of the life of Palestinians inside Israel in terms of yeah. This really affects every aspect of our life from the moment of the state, is from the Nakba, from 48 to 66, the Palestinians who stayed in Israel, the 20% of the population, were put under military rule. Their land was taken, basically stolen away from them. They were ghettoized. We live on like something like 3% of the land when we are 20% of the population. A complete development of education, economy, employment, all of that. So of course that negatively, and segregation. I'm not sure how a lot of people understand how much segregated Israel is, where that 90% of the Palestinians who have Israeli citizenship live in Palestinian-only towns. And it's kind of like a Jim Crow, like the South in the USA, where you have almost complete segregation between Jewish Israelis and Palestinians. And on the other hand, also, of course, lack of access to healthcare services. So it definitely is more people tend to talk about it as a second-class citizenship. It is not. Second-class citizenship really implies that there's a ladder and you can go up from being third class to second class to first class and so on. No, it treats us like enemies. You're literally stealing our land, taking our budgets, ghettoizing us, limiting the space where we can grow as a community, lack of an attack on every aspect of life. And this, of course, creates, and in other places, it's direct, home demolition, police attack, and so on, mainly in the Naqab. So, of course, this creates a very different lived reality and different health outcomes.
Thank you so much. I don't know, Yara, if you wanted to add anything to that, or?
No, I think Osama's the expert on that topic. He speaks from personal experience. I think that was a great summary.
Okay, brilliant. Yeah, thank you so much. That was, a great answer. So someone sent me a question because I'm sorry that apparently the chat was disabled before. So I'm going to ask the question that I was sent, and then I see that Christos has a question as well. So, okay, so this question is from Joan, and he said, could you provide an assessment on the mental health of the population, for example, depression, anxiety, suffering, pain, fear, despair, etc., and the potential impact that this may have on the political struggle for freedom and equity?
Yeah, I can start. So, I was talking a lot about the pre-existing kind of research and reports and evidence of Palestinians, and a lot of it is on mental health. And so, you kind of take a population in Gaza at a refugee camp in a village or something, you give them a survey, and it tells you that they have depression, they have anxiety, they have PTSD. So you won't be surprised to learn that by those measures and using those methods, the rate of mental health trauma, mental health ailments, distress is quite high. This is not just, I always tell people, if you just go for a day, you will completely, not completely understand, but you will see what Palestinians have to undergo day to day. This isn't even just avoiding gunfire. This is applying for a permit, going through checkpoints, just seeing soldiers in your town. It's daily trauma. And so, while the medical literature tells us that it's high, and so would intuition, I think it's important for us to kind of, there have been many Palestinian scholars who have pushed more towards other aspects like insecurity, like social suffering, that it's not just anxiety, it's not post-traumatic stress disorder, because you're living in the trauma every day continually. It doesn't just take a bomb to make you feel traumatized. If every time you have to leave a village you see that there's a gate, if every time your child leaves the house and you see a soldier tank driving by, it's constant trauma. So I think I think that there has been much said about this kind of sense of Palestinian resilience, where Palestinians are actually quite well adjusted considering the situation that they live in. Even in the Gaza Strip, where it's truly an open air prison, you still see expressions of joy. You still see people having families, having children, having birthday parties. I mean, this isn't a depressed population. This is a population that tries to choose life when possible. But I think that while it's kind of part of the Palestinian identity, it's also it's a forced adaptation. It's a maladaptation to unnatural circumstances. And so I think the extent of these studies is limited because we don't know how to capture that. We're used to seeing a pre and post, right? Where we have made mental health so clinical and so measurable and so testable. And, I wonder how well that even frames the mental health of Western societies, where a lot of these, measures were produced, but if it's even applicable to these kinds of societies under generational trauma, generational humiliation, generational loss. No, there's not a single Palestinian anywhere in the world that does not have a story of loss, if not a personal experience. And so I think it does contribute to this kind of shared Palestinian identity, because it's really hard to understand what living as a Palestinian, especially if you live in the territories, is. And so, but I also think it does lead to significant, poor outcomes. We do see higher rates of sometimes child abuse and domestic abuse. We see, we don't know yet all that the psychological impacts of living under this. And so I think we also don't want to be too limited by what we measure is all that's important. I think if any human being, just looking at the pictures that I showed you, would recognize that this is not suitable for human life, even if you're rich, even if you're poor, living under these conditions. So I think there's a lot more critique and nuance that the mental health field in these kinds of populations needs to make.
Yes, thank you, Yara. I fully agree, of course, and I think it's really important to reflect that the history of mental health has been a very colonial one, right? Even from especially the ones of PTSD and depression around the Vietnam War, to talk about what is a normal reaction and then what is an abnormal reaction, and how these soldiers that came back from Vietnam were these broken soldiers that you need to fix in order to return back, and so on. So it really tries to define what is normal, what is abnormal. And when you come and try to examine these tools in Palestine, where everyone is having kind of a abnormal living condition, there is nothing normal about it. So it's not about people having a abnormal reaction to normal life condition. They are having normal reactions to abnormal life condition, right? So and this would be a very different research question, right? So we can ask, how do Palestinians who live in such places that are saturated with death and you don't know if you will live or die or so on, manage to live and find joy and create meaning and happiness and so on, This is a different one from the traditional mental health methods that are used in Palestine to come and generally with refugees and with marginalized group to come and screen how, as Yara said, what's the percentage of people that have PTSD or depression. So let's send some more money to mental health, as if also the solution would be to go to a room with a psychologist that you don't know and talk about your problems and then be treated and go back. So all of this approach, of course, fails also in its conceptualization and what it offers as a diagnosis and also in terms of treatments that it offers. And in this, there is a growing field of papers that think to the contrary, resistance, when people resist occupation and resist their dehumanization, this is how they find mental health, and this is how they treat their depression, anxieties, traumatic stress disorder. It is a way of healing, right? So resistance and claiming your humanity is a way of healing.
Thank you so much for those, really interesting and nuanced answers. So there's a few questions coming up. I think the first one was Christos. So I'm just going to try and see if Christos can speak. I don't know, Christos, if you, yeah.
Can you hear me now?
Yeah.
Yeah, thank you very much for the presentation, very illuminating for me. My name is Christos. I work at the Public Policy Center here in Barcelona. I work on different issues. I work on environmental issues, but I am familiar with the settler colonialism approach and some of the issues you mentioned. My question is about the cooperation approach that you mentioned, this kind of Palestinian and Israeli medical cooperation approach. And I think it's two questions. The first one is how big that is as a project, how mainstream or how influential you think it is, for example, with international organizations or with countries that have political power and a political say in the whole issue. But I think I'm more interested also as to what are the Palestinian politics about that, in the sense of what would be the views of either the population about it or perhaps institutionalized politics or even more grassroots civil society politics. How do they see that? Is there a debate, or is there a rejection from all sides? Because I can imagine this can be tricky. Thank you very much. You can silence me now. Okay, I'll silence myself. I self-silence.
So I'll briefly start, and then I'll turn to Osama because I know we just have a minute. But so much, if not all, of the money that Biden committed to the Palestinians, a big chunk of it is going towards one of these kind of cooperation / coexistence type efforts. So when you look at governments, when you look at USAID, when you look at some of the initiatives from the EU, this is what they push. That, if we're going to have two states for two peoples, then we need to teach them kind of how to get along and be neighborly. And, if Palestinian doctors train in Israel, or if Israeli doctors do these short-term missions to Gaza or the West Bank, ... that will lead to peace, right? So how big is it? I would say it's big in the eyes of governments and donors. They love this model. They love the words cooperation. I mean, it's no accident that that's what the UN called it initially. I think, it's difficult because in my experience, when you ask Palestinians, nothing is like healthcare. Like when you need healthcare, you need it. And so if you ask a Palestinian who is ill or whose mother is ill, and had this experience in my own family, they will take help from anyone and anywhere. They need the services. They don't want to die. They don't want their mother or their child to die. So if it comes as a result of a cooperation effort, they'll accept it. I think in widespread, they don't like these efforts because it does posit these as two, again, neighbors, two sovereign entities where one is simply helping another. It completely belies Israel's responsibilities as an occupying power. It completely ignores all that Israel does to create these health inequities to begin with. And in many cases, it's paying Israeli facilities and providers and services to provide care for Palestinians that the Israeli military and structural apparatus have created as victims. So it's not for, in terms of long term, I think, the two-state model is, I think, long gone in most realistic viewpoints. And so to continue this kind of Oslo era, like, let's just, help them be friends, I think is not only naive, but it just shows that the international community is so behind on the reality of this. That the PA will take cooperation efforts because it benefits them, it boosts them as a, unrepresentative, hasn't been elected in almost 20 years, entity that does not serve the people. They have very poor public polling. But when they can say, hey, we brought 20 million to do this, or we can, irrigate this field now, it makes them look good, it boosts their power, it keeps them in the elite strata, which is all they really care about. So it's big, it persists, it takes a lot of the money, and it's not helpful in the long term.
Thank you so much to both of you. So it's 7 o'clock. There's 2 more questions. I don't know if people are happy to stay for a few more minutes. If we could try and cover these 2 questions that we have, that would be great. Yeah. So so one of them that I've got here is in the question and answer, which is, thank you so much for this opening webinar. I appreciate all the work that you all do for Palestine. This was a great introduction to the history and transformation of the Palestinian health system for me. I'm really interested in learning more about how the system works and how it's transformed. Do you recommend any readings or sources that describe the history and transformation of the medical health system in Palestine and where it stands today, either in Arabic or English? I'm wondering, for the sake of time, maybe if you could write some references in the chat, that would be great. I'll just make sure that you are able. If maybe we could do another question and meanwhile you could write references in the chat. Does that sound good? Okay, wonderful. Okay, so the other question is from Rania. Thank you for the brilliant presentations and a really interesting discussion. You spoke about the right to health through the settler colonialism and apartheid frameworks. Do you think these are more comprehensive in advancing Palestinian health than the occupation framework?
Okay. Yeah, thank you very much. Rania is a dear colleague from Al-Haq, who's also been working a lot on this issue and helping us understand the complexity of the situation. So as we've recently done a workshop with Yara and other colleagues about what of these frameworks of occupation, settler colonialism, apartheid, racism, how can we understand things better? And we all came to kind of a conclusion that these are like different lenses, that sometimes you need to put that lens or that lens in order to understand the situation better. And this, of course, is a very different whether you're in an academic or an NGO worker or an advocator that's trying to write a paper or an academic paper. And when it comes to actual work on the ground, I think you can use both differently, right? Because apartheid is a crime, right, that has punishment, versus settler colonialism that is not, versus occupation that has its duties and so on. And all of these have been used interchangeably. So if during the early 90s, there was kind of at the beginning of a polio spread in the West Bank, and then Israel as an occupying power took its responsibility and vaccinated, big amount of the Palestinian, of course, because it didn't want it to spread to its own. This, we can say, might have been worked good for then, it's better than not vaccinating them when you're talking about the spread of an epidemic, but it also changed during the time to what we see now from COVID. So I think we need to use them strategically in order to improve the health of the population and work towards independence and justice.
Thank you. I don't know if you want to add anything to that, Yara, or no? Okay, great. So I think Yazid had a question. I'll just let them speak. Yazid?
Yeah, thank you so much both for this great seminar. I'm an aspiring researcher when it comes to health in Palestine. I'm myself from Palestine, from the West Bank. And I really look up to a lot of the work that you do, both of you. So thank you so much. There's a lot of different comments. There's a lot of questions in my head, but I think a main question that I have to the both of you, because I'm aware that both of you have had a certain level of training in the US. And I want to see how is like your life and training in the US and learning about health disparities in the US when it comes to race had an impact on your perspective on Palestine. Yeah.
Yes, so I moved to the US as a young child from the West Bank. All my schooling, all my university training has been in US institutions. Um, I think if left to their own devices, I would not have a very critical view on these topics. What really taught me was going home to the West Bank, seeing it for myself, and hearing what my family was experiencing, often passively. I didn't really understand this as even an American when I was a young child, even going back, it was a war and it was very complicated. In my generation, your parents don't really like to talk about it. And so I think that one thing that I have benefited from in the US is being able to connect what I knew personally, which is the Palestinian struggle, with other grassroots struggles against oppression, and seeing, my whole life I was kind of taught that Palestine is so unique, it's so complex, it's so hard to talk about, you need to understand Middle East history, the last 500 years, or you'll never understand it. And so that's a burden of entry for a lot of people. And so in the US, especially, they just kind of accept the main narrative, which is that this is a war and it's complicated and there's some religious aspect and it's controversial, so don't really talk about it. But learning about, the experience of Native Americans, learning about apartheid in South Africa, learning about, the history of American settlement. And we're not taught in America how bloody and violent and ugly and transformative that was. And so when I, began to apply these lenses, as Osama kind of pointed out, that I had only used to look at Palestine, and saw this is, it really helped me understand that these are political structures. They're not accidental, they're purposeful, they're all connected. Oppressed people, we are not defined by race, we're not defined by class, we're not defined by geography or religion. What really binds us is struggling against oppression in a world that promotes impunity and power dynamics. And so I think that really helped me. And I think also living in the US has helped me really understand the primary Western arguments about Palestine. And so that has helped me in my work, so that I know what I need to work on. What do I need to counter? What are the prevailing assumptions and biases that I know are wrong? And so how can I use my work and my expertise to help counteract that? And so I think COVID was an amazing opportunity, a rare opportunity to do that, because COVID is an issue that everyone understood. Americans understood that we needed vaccines. Some people weren't getting them, some people were. And so applying that very universal framing to what's happening in Palestine, I think helped some people slightly understand what was going on in Palestine. And so it's kind of this chipping away, trying to help people see the reality. And so I think that was a big benefit to me.
Thank you, Yara. And for me, so I grew up in the Galilee, and I went to med school in Israel. So I went to med school. I did my MD and my MPH in Israel, in Tel Aviv University. And of course, there was no mention whatsoever of all of these complexities. It was just, a celebration of how good is the Israeli healthcare system, and then how much we are helping the Palestinians, and so on. So there was absolutely no critical voices. I grew up in a political environment. I knew, scholarly work on settler colonialism and apartheid, but did not find a way to kind of cross it with medicine until I was introduced to more the American work on public health, of the works of Nancy on racism, on Nancy Krieger, and other forms of work in the US, which is much more critical. And when I did my fellowship in the US at Emory, then I got even more exposed. So And we have some leaders in this field, pioneers who've really shaped our understanding and knowledge, like Rita Jakaman and others. But the field is very small and still in construction. So we hope we can contribute to its expansion. Also to better understand the health of Palestinians, but also to really use Palestine as a lens to understand these complexities of racism, oppression, apartheid, colonialism, and so on to other populations in the world.
Thank you. So there's only one more question. I don't know if either of you have to go. So let us know if you have to go. If not, I don't know if either of you is interested in answering this from Sam, saying, thank you so much for taking the time to give such a comprehensive and interesting presentation. I think the way you so clearly demonstrated and focused on the inequities in a single sector is very powerful. It made me wonder if you think this approach better connects the wider struggle with health professionals that might not otherwise be aware. And related to that, and maybe to draw in other groups, are there similar initiatives specifically focused on reaching out to other sectors, for example, to show inequity in nutritional security, energy, housing, or legal process?
I think Osama and I are both kind of proponents of this de-exceptionalization of Palestine, and I think Osama just summed it up perfectly, is not just using these lenses to study Palestine, but to use Palestine as a lens to understand other areas of oppression. Part of the reason I got into health and not, strictly political science, which I think most critical scholars in this field go into law or political science, is because health is universally understood. I think health professionals, that have an appreciation of social determinants of health, when you show them home demolitions, when you show them children being bombed, when you show them the water disparities, like these are facts that health professionals really intrinsically understand. And so I do think that there are particular pathways in health, both because the general population understands health. We've all been patients. We've all seen family members be patients. We all know that we would do anything to gain our own health. And also connecting it to all these different other facets that determine health: homelessness, food insecurity, water insecurity, racism, discrimination. I think that health is a very powerful tool for that, and I think Osama would probably agree. I mean, that personally, that's why I went into health specifically. It's always been an interest of mine, but in terms of similar initiatives, there are so many grassroots organizations that are trying to do this kind of work and connect all these kind of dots. I think the main problem is that many of them are small. Many of these are reports that are published that are maybe read by like-minded audiences. I think there's not a lot, there's a lot of critique and silencing when it comes to activism and advocacy about Palestine. And so oftentimes when initiatives do try to come forward, they are pushed aside. And so that in that way, I do think that the apartheid framing from Human Rights Watch, Amnesty, etc., can be useful, because it suddenly gives this widely understood framework that applies to health, to agriculture, to housing, to all aspects of life. And so I'm interested to see where the movement goes in terms of de-exceptionalization, now that these are kind of accepted language in this realm.
Yes, I fully agree with Yara, and exactly as she said, I think Palestine, like, it concentrates a lot of the processes that happens everywhere else. It is the direct, if you had the global south and the global north, squeezed into each other on a very tight, small piece of land. So the same processes that also, we see European and the countries of the global north that exploit the natural resources of the global south, right? And they practice some form of apartheid and neo-colonialism and different modes of occupation and militarization and structural racism. So all of that is there, and Palestine becomes kind of a crossroad to understand all of these complicated processes. But as Yara said, when we and in the US especially, there is this race towards progressiveness, who is more progressive, who talks about this and that and so on more vocally. But then when we mention, yes, bring Palestine to the conversation, there will be a huge silence, like no. We've tried this a lot, and there's a lot of censorship you'll see with journals who will do special editions on racism and so on, but will refuse to publish anything that has to do with Palestine. So this is what we need to fight against. And again, this is an opportunity to thank you, Eve, and John Hopkins for providing this space, and it's very much not taken for granted.
Thank you. Well, thank you so much to both of you. It's been extremely interesting. Yeah, I feel like I've learned a lot, and really appreciate your time and the way that you've explored all of these. There's so many complex themes there, but they've all been explained really clearly, and in so much detail as well. So yeah, I hope that, thank you to everyone that's attended. I hope you've all enjoyed it. Thank you for your questions. And yeah, I'm really happy to have been able to share this with you. So thanks very much. Have a nice evening.
Thanks for the invitation. Take care, everyone. Bye-bye.
Yeah, thank you, everyone. Thanks for your time and attention.
Bye.